All right, all right. But I
All right.
do. How
We are
long have we been?
live. Mark Milligan, we're live. Welcome to the TelePT Connections podcast. I'm Dan,
I'm Adrian Miranda.
and our guest here today is Mark Milligan. He's got so much to talk about. He wasn't even going to let us do an intro. Mark, what's up, buddy?
Nothing, guys. It's great to see you. Thanks for having me here. I love the podcast you guys have been putting out. Solid. It's rocking.
Thank you,
Appreciate
man.
you.
Thank
Yeah.
you, thank you. We've been holding out, waiting for this episode. You were definitely on my short list from the beginning. I knew you had a lot of things on your plate,
Yeah.
so we kind of held off for a little bit. And tell us what you've been up to.
Whew. Well, I mean, as you know, telehealth in the physical therapy space is it's evolving pretty rapidly. I think there's so many layers to hit here, right? So on a professional stand, on like just an overall global view, telehealth in our profession's got a few things happening, right? We've got some states signing in and some payers signing in some big
Yeah.
laws and some big initiatives to make sure it's included. We've got compact states that are popping up everywhere, so that's pushing forward. We've got Practice Acts Arizona just signed in the ability for PTs, or it's about to be good for PTs in Arizona to provide telehealth, which before they weren't able to.
Just
So
not
there's
allowed. They were completely blocked from
completely
doing.
wasn't in their
I
Practice
didn't know
Act.
that.
Yeah. So
Right, right,
now
right, right.
yeah, so Arizona, the governor finally got all that tied up, and the legislature tied it up, and so that's actually going to be a thing to happen in the next couple of months. So it's been signed, so that's awesome. The only issue is that PTs aren't doing it. So we've gone back to almost baseline numbers as a profession to
Yeah,
pre-pandemic
yeah.
levels of telehealth usage.
What in your mind? What's the problem?
I think there's a few issues. One is, I think the biggest one that people will talk about, well, really won't talk about, is payment parity and payment.
Yeah.
So there's been a ton of, I've talked to so many PTs that we love PT, we love telehealth when it's all we had, but now that we're back in business, we're pushing to go back to getting paid for it. So there's a force from big
Yeah.
orgs to get back in person.
Yeah, I think, and they are getting paid for it now, but there's
Right.
no guarantee that once public health emergency is over, that they will continue to get paid for it. So companies are not investing in the infrastructure. They're not going all in for that reason, I guess.
Yeah, but you see states like Rhode Island's got parity that's built in,
Yep.
right? Past
Yep.
pandemic. Washington State, parity past pandemic. Like
Payment parity, right? We talked about this
yeah,
last episode, Adrian.
yeah,
Payment parity, right on.
yeah. So there's states that are adopting this, and there's
Yep.
large payers that are adopting this, and like there's I think people are sitting back on their laurels, like just saying, "Oh, we can get back to in-person care," when there's all this under stuff going on in the telehealth space, and they're going to be missing some boats, right? They're going to have to play
Yeah.
catch up again on the backside.
So in
So,
your mind, and we know about the benefits, like why do they need to be doing it?
Dan, there's so many reasons, right? From a patient perspective, we need to be able to meet patients where they are.
Yeah.
That's it, right? Like there's if we take off our PT hat and we take off our kind of own bias, like we really if we look at and answer questions from the patient's perspective, which
Yep.
we should when we're evaluating them, when we're treating them, all of that stuff from we should take off that hat and say, look, how would the patient want to be treated, or how is the patient going to see this? We need to have our services available for them in the ways they want to be met, right? Gone is the old way of forcing people through a funnel into your clinic. That's going to be gone, and that's going to be gone for a lot of different services, right? Not just PT. So
Sure.
the offering needs to be there, even if it's 10%, 20. Why would you leave 20% of your business model on the table if all you need to do is offer somebody to connect with a video visit? It doesn't make sense. We have to meet the patients where they want to be met, and I think that's the biggest thing. Secondly, they need to do it because of all of the different environmental factors that can contribute to lost revenue, right? So cancellations, no-shows, weather events, sick kids, traffic. Austin, Texas, New York City. Adrian, remind me where you are again?
Yeah, I'm in Manhattan.
Manhattan. Yeah, traffic sucks, right? Especially with the introduction of all these different. I think I just saw that there's a new Uber about to happen. Electric vehicles that are sidestepping the New York transportation laws. So they're gonna start doing electric vehicles as Ubers.
I hadn't heard that, but it was only a matter of time.
Yeah.
Yeah.
So like,
For sure.
look at traffic. Look at availability across larger landscapes, right? I mean, there's a large country out there that people can need and use your services. So I don't know, man. From on every level, an organization needs to look at how telehealth and how video digital care can be integrated into that clinical pathway of that patient. Plain and simple. Yeah, I mean,
you've been talking about this for years, and
Yeah.
that's kind of how we met at
Yeah.
PPS a couple of years ago.
Totally.
And I had seen some of your other presentations before that, and we got to talking, and we've had this conversation and similar conversations. But you've definitely taken it to other levels, which
Right.
I mean, you're pushing it on the profession, you're pushing it to the profession, you're pushing it for the profession, and I think, I mean, you definitely have influenced a lot of people. You've influenced me, and you're doing things on your own as well.
Yeah.
Go ahead.
No, I was going to say I hope that I'm helping people see that there's opportunity,
Yeah.
right?
Sure.
From Anywhere Healthcare almost 5 years ago, it's going to be super exciting. We have our new platform. That website's almost done. We're going to have a new digital platform for patients and PTs and other healthcare providers to engage digitally. So that's exciting.
Yeah.
So that's fine. That's been a long road. That's been almost a little over a year since I said we needed to redo everything. It's taken a long time. That stuff's hard. And so helping people actually connect with patients digitally I'm super excited about. The PPS COVID task force is now no longer in effect, but I'm now the chair of the PPS's payment policy committee's telehealth task force. So still working on the back end and the private practice section of how we can really push our profession forward and what people need to see from the private practice section. It's like people are like, why do I need it? And so we're creating content around the value of what digital health can bring businesses, which I think is really powerful.
So what kind of feedback are you getting on that? Like you're putting, I mean, PPS put out great content, I thought, from a year, this time last year. I thought they were extremely informative. They were informed, which was like really relevant too, because there was, I got a lot of my information directly from PPS and couldn't have done a lot of things I did without them. What about now? So now you're building this library of content around telehealth PT. What are private practices actually doing with it?
Yeah, that's a
How are
great
they
question.
responding to it?
That's a great question. And a lot of them are really just they're in that waiting space, just like a lot of people in this country. They're like, we don't know really what to do. If we go this way, are we risking losing, capital and investment and time and energy? When are we going to get paid for it? So like navigating that space and understanding the value. I mean, I still get emails today regularly. Hey, I'm in this state. Can I treat somebody in this state? Hey, I'm here. How do I get paid here? I'm like, it's a consistent theme that
all the time. Yeah.
Knowledge on how to perform interstate practice, how to get paid for it, and how to document all those things are still really relevant. And so we're still working. We're putting together a webinar for a couple of months that should have an idea. I think we're done with the nuts and bolts of how to do telehealth. It's really the why. So it's going to be more surrounding kind of like the current landscape and climate of healthcare in general, and how that can apply on a larger scale to us as physical therapists, but also as PTs in the healthcare space. So trying to get people really to see the value it's been an interesting ride. Like it's been
like what's it going to take though? I mean, and I to me, I'm not trying to sell it. I'm not trying to sell it on PTs to utilize telehealth. If it's not your thing, then I guess you shouldn't be doing it. There will be PTs who will. Yeah. And I think that there will be, like you said before, the demand will be there. The market will definitely demand it. And, we both know it already is.
Yeah.
So like, what's it really going to take? I mean, to get either the next generation of PTs or existing PTs to buy in a little bit more?
Dan, I haven't really, I mean, I love that way you phrased that and frame that question, because honestly, what just came to me was really that we'll probably see kind of a differentiating path. Some PTs will will choose the kind of more digital hybrid route, and some PTs and organizations will choose and bet on the predictable kind of permanent brick and mortar structure, right? Or a few may go that hybrid route in that middle. So
Yeah.
who's going to do that, where they're going to do that, and how they're going to do that is still, I think, to be determined, because like we've talked about, there's lots of options out there, and no one's really paving the way in a clearly defined model.
Yep.
That really has been like, whoa, what are they doing? I mean, there's people out there in the direct to employer space, right?
Yep.
But there's nobody in the direct to consumer space, really. I mean,
Right.
well,
Not
yeah.
dominating it. Yeah.
Right,
No.
not dominating. Yeah.
Yeah.
I mean, there's a few out there, right? I mean, but there's really, as far as a nationwide network of telehealth solutions for MSK pain, it really doesn't exist.
Sure.
Right? I think it will. I think you also have to consider there's other, I mean, if there's no money in it, you have to understand and ask why other massive players are putting in their money in it, right? Walmart, Amazon, all these people are putting their money in digital health. It's just a matter of time till they try to tackle back pain, right? Like it's a no-brainer.
Yeah, I guess so. Like you said before, the money currently is going towards employers.
Yeah.
And I don't know. I mean, will healthcare continue to be directed through employers?
That's a great question.
I guess there's it's one area to get funded, one area to get paid for your services,
Definitely.
and a good way to funnel it, I guess.
I think that's just who's asking for it. It's
Maybe.
It's funny. I think a decade ago there was, are you McKenzie or Mulligan or Sarman? Now it's like, are you digital health? Are you hybrid? Or are you in person?
It's a great
And
point.
so, but I think it really is the employers are being savvy enough to ask it because they save. The consumer, I think, eventually they'll ask for it because Medicare is not going to pay. Medicaid's running out. There's no money coming from the government, and then whatever Medicare does, insurance companies are going to follow. So I think the time will come where consumers are going to be asking for it, and they'll kind of put us to to task.
Sure.
Yeah, I think there's some good assumptions there, right? I think that we need the assumption that Medicare is going to stop paying for PT and those codes. I think we need to fight that, right? I think there's a modifiable, like, those points in history where you think you can change the future. Like, these are things that we can do now to impact our patients and our profession's future by changing what happens. And if we don't raise our voices, if we don't really get loud in the digital space, other people will occupy it, right? And we will be prevented from being in that space.
That's true.
And I really, from all the things that really piss me off, it's that it's the people that are apathetic to the digital aspect of our care, right? Like, if we don't protect our rights and our scope in the digital space, it will be taken from us. And there will be a point, like in Arizona, where, let's say, a pandemic hit Arizona, and PTs, it's against your practice act. You can't even see a patient digitally. Every business would close, right? There wouldn't be an option, right? So we have to really work hard to protect our profession from that standpoint. I was about to use the inappropriate term, irregardless. That does not exist. Regardless of all of the payment and all of that stuff and business models, from a pure scope of practice and a choice, we have to protect ourselves as a profession, right? And that's what I think is really important. And
you're right. I mean, there's assaults on our space coming from all angles, right? I mean, we've talked about this before about Hinge Health and Kaya and others that are not necessarily employing PTs to do
PT
care of
work.
patients in the musculoskeletal space, where we are the experts.
Yeah.
You mentioned Medicare. What's your sense, and what do you know that we may or may not know about telehealth being covered by Medicare following the public health emergency?
I don't have any information on that. I know that the APTA, I would think that it would be a really, it would, once we push through this barrier and it's pushed out so long, it would be remiss, I think, for them to take it all away from patients.
Yeah.
And I think we're close to seeing that year long data. You know, we're about
Yep.
to get some Medicare data pretty soon about utilization. I have a feeling that we'll see the utilization data be lower than we expected. I feel like in the telehealth space, we've all done it. We know our visits tend to be shorter and we bill less when we bill insurance,
Yep.
right? But
Yep.
just because of how we treat people digitally.
Yeah.
And so I have a feeling that when we see the data, and it's my gut that when we see the data, it's going to be a very obvious, effective, and economical choice for Medicare to choose to have us see patients digitally. And that's when we have to say, look, we're effective and we're affordable. Now we need to get paid for it the same way we would be in person, right? So like
Yeah.
there's an argument that our information, what we can do as providers, doesn't diminish digitally. It's as effective.
Sure.
So combining outcomes with your utilization data to really drive the value of what we do digitally, I think is the solution.
Yeah, definitely. I did speak with someone recently about a MedPAC report, which basically recommended that PT, and there was just like one short blurb on PT, and it was that they approve it temporarily, at least, PTs to be Medicare providers, because of the fact that they don't have enough data, and the reason being that the data on PT is fuzzy because of incident to billing,
Right.
meaning that there's a lot of PTs or some PTs or other professions that bill for physical therapy incident to physicians, which,
Yeah, totally.
I mean, that's amazing to me that still exists.
Yeah.
I suppose there are some environments or some settings where it's appropriate, hospitals, for example, but for the most part, particularly in private practice, it befuddles me. I mean, we can bill under our own tax ID or our own NPI. Why are we billing under a doctor's NPI?
Well, there's contracted rates are different sometimes.
Yeah.
Right. And like,
So.
yeah, so there's other underlying things that are at play there. So and we saw that a lot in Texas. There's a lot of physician-owned practices that would bill under
Yep.
the physician's NPI. So I think that what will become, I think in the entire span of what you were just communicating, I think that it's important for us to remember that if we lose our ability to bill in the digital space, all 9,700 codes will have to be billed incident to.
Yeah.
Right. Like that in and of
That's
itself.
the confusing part in the data.
Right. But what's frustrating for us is the implications for that are massive. That means that we wouldn't be able to bill for our codes in the digital. That would basically take away all access to any type of digital. We wouldn't have direct access in the digital space, even though those for Medicare, we still have to have a referral, but like we wouldn't be able to see anybody in the digital
No, you
space.
wouldn't be able to treat patients who are covered by Medicare.
Right. But as Adrian reminded us that, other payers tend to follow suit. So they may stop reimbursing PTs for those codes. Right.
That's very possible. Yes.
Then we're
definitely need to fight for that. That's a great point.
Yeah. So it's a really, I think, one of the biggest dilemmas that face physical therapy since direct access came to be is direct access in the digital space.
Yep. I know that the APTA is trying to get get PTs eligible through the Connect Act, which the Connect Act is supposed to continue digital health beyond the public health emergency. And my sense is that PTOT speech will get attached to that Connect Act.
I hope
so, and I hope so too.
I know.
Sure.
I mean, it'd be a huge deal.
Yeah. So now you are the clinical director, clinical director at Vori Health.
Yeah.
Is that
So
the whole title right there?
Vori Health. So I'm the director of physical therapy and the director of clinical operations.
Nice.
So a couple of different titles as we're in the early stage of startup, right? So Vori Health was born in August of last year, and so we are what they call a full stack digital health offering. We're the only one that in the MSK space that offers physicians, advanced practice practitioners. So NPs and PAs. We have health coaches, nutrition, and physical therapy. So we are a point solution for MSK, pain and discomfort and conditions.
Yeah.
Yeah, it's an awesome offering because people on board, you get a visit, a sequential visit with a health coach, and then a physician or an APP or both, and a PT, all at once. So all in a sequential
All in
order.
one visit.
Yeah, all in one
That's
visit.
amazing.
Yeah, and
Very
so
cool.
health coach really is there to help that patient identify barriers and really look at larger goals and ways that they can help that patient navigate. The MD APP team are there to really make sure that that patient is heard and make sure their medical conditions are addressed or assessed. And then the PT is there to continue that treatment and help them with their MSK and create their treatment plan, right? So it's a really awesome, powerful a way to address people's.
Yeah, it sounds like it. And I have to imagine that one of your objectives is to control costs,
Oh yeah.
right? So how are you doing that if you have, 4 professionals and a paraprofessional, sort of a tech, at a first visit?
Yeah.
How does that play into the cost savings?
Yeah, so typically it's front loaded, right? So that visit might be initially a little bit heavy, but the overall touches and lifts throughout the entire plan of care are less.
Yeah.
Right. So the beautiful thing about how that works is that the patient after that initial visit may never see that MD again, or may never have that touch, or it may be a 15-minute follow-up, or an image follow-up, or something that is a touch, but it's definitely not as heavy as an in-person visit. And we also offer a lot of asynchronous communication through uploading of files and through digital communication, texting. We have, so there's ways that you can navigate and mitigate costs over the course of that patient's engagement. That even if that first touch is really heavy, that it's spread out over time, right?
So we patient-centric care, right?
Yeah.
That's what we're going for. I'm
Totally.
picturing now, is this an in-person visit or
This is digital.
or digital, remote?
Yeah.
I'm picturing
digital.
exactly that. So I'm patient in the middle, and like doc, PT, OT, health coach, whoever else.
Yeah.
Right around that, like
the Brady
literally
Bunch.
Brady Bunch, literally putting the patient in the middle. That's awesome.
Yeah. So, and it's beautiful, and we've got really positive. Our net promoter score right now is 100, and so we've
Nice.
been live with patients. We're live with patients in Mississippi and Tennessee.
Oh, it's great. Since when?
For 3. What month is it? I don't even know what month it is. May. So we went live with patients like 3 months ago. So we've been live for 3 months, and we have a couple of partners that we're working with in those states that identify people to come on board. But right now we're working on the direct to consumer model, and that should be, we're actually direct to consumer live in both Mississippi and Tennessee, but we're iterating different, in the startup world, it's all about testing and then assessing the results of those tests and then modifying, right? So iteration after iteration of kind of flow and plan and content and all of that stuff. And so we're working out based on patient feedback, based on consumer feedback, based on clinician feedback, how to best solve the solution for what patients need and how to triage it, right? What if somebody comes to Vori and they just want like weight loss or smoking cessation that our health coaches can take care of? How do we just get them into that bucket and so they just see a health coach, and that's okay too. So there'll be some direct to consumer offering that will be more tailored towards what the patients want.
So when you say direct to consumer, is that the marketing end of it? Is that the payment end of it? Like what exactly?
No, so right now it's a patient flow model. So right now, if you're in Tennessee or Mississippi, you can go to vorihealth.com and download the app and go through the process, and you'll be contacted by a customer service agent, and they'll triage like your needs and then get you set up with your appointment. So we're live with patients that have any type of musculoskeletal complaint in those states.
In those markets, yes. How are the patients actually finding you? Is it
right now? We're still super stealth. We're super stealth. We haven't done any.
Yeah.
Our announcement of our Series A funding was the biggest publicity we've done. Other than that, It's just some word of mouth things that are happening, and just communications around. We haven't done any marketing at all. Yeah. So right now because
So how are they finding you?
through the website, through
Yeah.
LinkedIn, and there's a few
We have a
providers.
network of docs too.
Yeah,
I mean,
yeah,
right?
a few
I mean,
providers that have been sending us those patients as well, because
Mhm.
a lot of docs in rural Tennessee and Mississippi, there's a post visit kind of void if they have to travel there's an access issue, right? They
Yeah.
may have to travel a couple of hours, so they'll see a provider, and we can be their digital solution for their patients that may not be able to get back that easily, right? So
Yeah.
there's been some patients through those. So it's just about creating the awareness of our availability and what we can provide, and how that really fits with the models that of other care providers that are out there that need it, right?
Yeah.
And other patients, really. And so eventually we'll move into that kind of push, the marketing push. But right now we're just still creating the best product, and still creating what makes the most sense for patients. It takes time. Like if you think,
Definitely.
yeah, I mean, most big organizations, it's you don't really hear about them for a few years until they're like, oh, now here we are. But they've been working behind the scenes, and so we're definitely, as an organization, working hard behind the scenes to get everything right. We don't want to screw it up.
Yeah.
I mean, there's one thing to say that, the 80-20 rule is you get it 80% of the way there and you launch it. But there's also that if you have a bad customer experience, like that's hard to overcome, right? So we got to make sure that that's right.
Sure. Did you have a vision for this before you started with Vori or Voya at the time?
What was the start?
Did you have a vision for this?
Yeah. So
beforehand?
my vision for Vori is a PT first digital hybrid model, right?
Mhm.
Like
Nice.
that's what it's about. It's a physical therapist practicing at the top of their license as laws allow, in a way that on a collaborative team that's a patient first model, right? Like that's what it's about. And so we hire we physical therapists are that's our treating person, right? We don't
Yeah.
hire any other extenders to do that. So we will have PTs that deliver physical therapy care, and that's definitely something that I stand strong with, right? Like it's
Yeah.
that's what it's about. It's about us doing the work, and that's
So why PTs? I mean, besides the fact that you're a PT.
well, because that's in my belief, I'm biased, are the best
Are you?
providers for that type of,
I
a
don't think
little
you're
bit.
biased. I think you're
Yeah,
right.
yeah. So you're biased too, that they're the best providers for that kind of MSK care, right?
Yeah.
Like, I mean, we as providers, we spend more time with patients than any other provider out there. So we're empathetic. We like to connect. We have a good opportunity to connect in the digital and physical space.
Yep.
And so it just makes sense that with our knowledge and our doctoring profession, that we be the MSK kind of frontline providers of choice.
Yep. I mean, I also imagine that there's a network built in and a process for referring out and
Oh yeah,
for patients that are not necessarily ready for or appropriate for PT.
totally. Oh yeah, we clear all red flags. We have
Yep.
we have opportunities and availability to get people on the ground people. Also, with the physicians on board, we can like triage other red flags and then urgently escalate if imaging's needed, things like that. So that's the cool thing about having those other providers, is that you have the opportunity to really collaborate across the team, and like it's awesome to hear our health coaches and our PTs talk about the successes of their patients and how they're working together to get them where they need to be. It's like, if the patient needs to lose weight and they hurt moving, it's hard for that health coach to help them navigate that. But if you have a PT helping them with their pain, and then they're able to move, and the health coach is modifying their behavior and choices while the PT is getting them able to actually perform the exercises needed. It's like it's a really awesome thing to see, and like patients are responding really well to that. Imagine like you have somebody
I wish I had that back in my private practice days.
Yeah.
At least once a week, I would get a new patient sent to me by an orthopedist who had gone to their primary care doc, who told them, you need to lose weight. So the
Right.
patient would go to the track and walk a mile. And then the next day, no matter how sore they were, they'd walk a mile again. And no one told them how to exercise. No one told them what they should be eating before or after or every day in between.
Yeah.
And now we're treating
Shin splints and plantar fasciitis and
exactly
knee
and
pain
inflamed meniscus and
right.
you name it.
Yeah. So it's a really cool opportunity. It's like, yeah, it really does feel different. And even though we're not together physically, it actually, the connection's really quite awesome. So, and patients, and patients are really saying positive. They're reporting, and patients are losing weight, like, 10 pounds, 20 pounds. So it's like, it's awesome. And yeah, so it's been quite a ride, and I hope, and as we continue this process and entering new markets, I think it's going to be just as we grow, going to be an adventure to see how we can bring PT in this kind of space to the masses in a different way.
I think PT definitely needs to evolve. I think our current model is broken and breaking further. There's still plenty of PT companies out there that are pushing ahead, and they're driving what they're doing, but it's not going to last in this shape and form. It's not going to last much longer.
Yeah, we're evolving, and I think it's going to be, like I said earlier, it's going to be there's be choices, right? It'll be an interesting path to see who.
It's not going to happen overnight.
That's not. Maybe before I die, but we got.
Well, that's already happening, Mark.
Oh, I'm dying. What? No, I am dying.
Well, we're all dying, but that's. But you are creating the change. It's amazing. Have you thought about? I'm sure you have. What do you think about automation and how that's going to play a part in musculoskeletal care?
Yeah, I think that there are spaces that are undiscovered and unexplored, and so I have a feeling that there will be a lot of push in the space, and there will be a lot of response. Right. So, like, as we look at AI, and as we look at predictive analytics, as we look at data mining, as we look at wearables, right? Like, this is for your watch is now for a remote patient monitoring. Your watch is now a reimbursable. You're a reimbursable patient for a remote patient monitoring organization, right? So, like, as we look at this type of thing, I know the Aura Ring, right? The Aura Ring actually has predictive. Their algorithm has predictive analytics.
AI, right?
Predictive analytics around COVID. They can tell if you're sick like 7 days before you're sick, right? Based on your Aura Ring stats. So I think that
as you have to be in the NBA to have one of those, though.
I think you can order an Aura Ring, but you have to be in the NBA to get in that study. I think. I don't know.
Oh, that's.
But like Mike Eisenhart's working with Fitbit stuff to do predictive stuff around COVID as well. So we have PTs that are actually engaging in that space, which is really awesome. And so Mike Eisenhart, I think, would be an awesome digital solution person to be on this podcast, because what they're doing with the APHPT.
No doubt. I just wrote his name down. I talked to him a couple of times. I'm going to definitely reach out to him.
I know. I love Mike. He's awesome. Also, Perry Brewbreaker would be good on here too.
Don't know Perry, but
yeah, she's working. They're actually doing some stuff with women who are pregnant and some high risk maternity stuff in monitoring. It looks pretty awesome and content. And so, and then Mark Rubenstein, he actually started a direct to consumer.
Every time I talk to Mark, I have to go to LinkedIn after the conversation and either check if I know this person, have ever met this person, or have ever communicated with them. And if not, I have to reach out to them. It happens every time we have a conversation.
Mark's awesome. And
I meant you.
Oh, no, Mark. Yeah, Mark Rubenstein is awesome. He's up there in New Jersey as well, and he's doing some powerful stuff. So, and so there's lots of people that are pushing us forward. And when it comes to these predictive analytics and all this AI, and it's going to be interesting to see how it's woven into our traditional care. Yeah. And where there's going to be a breaking point, or where there's going to be pushback.
Are you utilizing any automated
Not right now. No,
functions right now?
no. It's
Yeah.
all. Uh,
One-on-one, human-to-human care.
yeah, yeah. All of our care is
Yeah.
delivered
Great.
via either async chat,
Yep.
right? Async chat or live or
Yep.
synchronous video.
I think what you're doing, you're changing the model of delivery of care. It would be too much to throw all of that stuff in at this stage.
We are doing
Also.
async PT exercises, so that's
Mhm.
that's so our home exercise program is not delivered
Okay.
live, right? So there is
Hmm.
that aspect.
And that's
So,
monitored, and it can be
not yet. No, not yet. Well, monitored. We're not
monitored
watching people.
just in terms of like utilization. Can the
Yeah,
PT,
totally.
right?
Yeah,
The PT
yeah,
can see how.
right. We can look at utilization. We're not able to see, like, we're not watching people on their camera and stuff like that. That's
I
creepy.
should hope not.
Yeah,
Without them knowing.
that's a little too far.
So I have a question. So I'm
Yeah.
just fascinated hearing you two talk. But what are the challenges, Mark? I mean, you kind of mentioned that there's gonna be two different like schools of thought, but also what are the realities if you're trying to convince somebody to come work with you or for you, or
Yeah.
even the consumers or investors? Like, what are the challenges that you are either foreseeing, going through right now, or that you can kind of help people buy into this?
Yeah. So from a patient perspective, patients, I mean, what this past year was our 100-year anniversary as a profession, right? And we spent 100 years convincing people that they need to come see us in a clinic, right? And that we need to do things with them and to them. And so from a patient perspective, there's a little bit of a resistance, like, can I do PT digitally? Like, is that going to be effective? Right? Like, so there's a little bit of pushback occasionally from a patient perspective about what we can do and how we can deliver care and the value of what we deliver. I think that's one of the biggest things. Second biggest thing is the technology void. If anything that COVID and this pandemic has taught us is that there's actually a larger um, digital divide with patients and populations that are, minority populations or disadvantaged populations. So there's actually an access issue that we thought tech would solve, but actually it's been made quite obvious that is even worse than we thought. So access to good Wi-Fi or cell service, access to tablets and other technology that allows people to be seen in their homes, that's another barrier. So solutions around those things are super important to make sure that the tech is easy, it's very low bandwidth and in very low memory width, so it's not taking up a lot of space. So solutioning around that has been I think one of the biggest things. And also payment, like a lot of digital health, in the digital health space, nobody's taking Medicaid, nobody's taking, nobody does that, right? So being able, because we offer our service to Medicaid patients at Vori. So like actually offering digital care to patients that need it, I think can help with that solution. So
that you just put two challenges into one scenario that
yeah,
like really compounds the challenge or
yeah,
the complexity of it, which is you're talking about providing services to patients with Medicaid, who that same patient probably has or potentially has lower level tech, and so you're really
yeah,
like your market really um, obviously you're trying to serve the market that needs the services the most,
right. But it's challenging.
but challenging. Yeah.
Yeah, but and also look at Tennessee, where they're 2 hours outside of the city. It's like, I mean, that's rural. It's like, it's not like Tennessee isn't Texas flat. I mean, there's a lot of hills over there. So looking at just honestly cell service
It's
and
not, when he says rural, he doesn't mean like 187th Street, Adrian. He means like really like
I mean like Yonkers.
like sure.
Brooklyn. Sorry, I was
I
Brooklyn
mean,
growing
like
up.
to us, sure, right? I mean, it means like deep Brooklyn. Yeah.
Yeah, deep Brooklyn. Yeah, so like so I think those are some of the biggest barriers from a provider standpoint, from getting PTs. I still have PTs that are like, no, I don't believe telehealth is an effective way to deliver care. Like they just literally don't think they can do anything. And I'm
I
like,
call that the intellectual divide.
Yeah, right. How does this work? Right? Like I got to get my hands on somebody.
Yeah.
And so that's still very real. It's still very present.
Yeah.
And look, for those people that spent 20, 10, 5, 8 years, like I went through an orthopedic residency. I went through a manual physical therapy fellowship. I'm a board certified fellowship, dry needling physical therapist, right? And I still believe and know and have data to support that our care can be delivered in a digital environment and patients can get better, right? So I
Yep.
think that's one of the biggest barriers from a professional standpoint, and also from a professional kind of barrier. Um, PTs just are pretty risk averse, um, and so
You
they
agree with that,
like.
Adrian?
Yes.
Okay. Okay.
He leans into the mic. Hell
Well said.
yes.
Well said.
Yeah. And so a lot of PTs are, and they don't like change. And so having people to kind of take risks and do things differently. And like a lot of my time is managing and like kind of recreating what's possible.
Yeah.
And
I think it's I mean, to your point, I think it's a medical healthcare
oh yeah,
issue as well. Like I was just on a call with the game developers who happen to be medical professionals. And one of the things that we came up with was the fact that we are somewhat unicorns and we have to kind of figure out how to bring people along with us, because there is going to be a lot of pushback, like you said earlier, kicking and screaming. And I think that's like, we can kind of preach it on the mountaintops, but we got to show them somehow. And it's almost like our unfortunate responsibility to prove it, and
yeah,
that whether you believe it or not, it's there, it's going to happen. And I think it's that's the challenge as well. It's like, how do you convince people to tackle on this? Is just a new challenge. It's not even the challenge. I mean, it's digital. We all are on digital at this form,
right.
so
Well, I always think of the adoption curve, right? The adoption bell curve. You got those super early adopters, those innovators the innovators that are way out there. Early adopters are a little bit behind it. And honestly, like part of me for a long time in the digital space worried about the big hill behind me of what everybody else thought, right? And over the last couple of years, what anything has taught me is that I just need to turn around and look forward, and that curve will follow me, right? And so like that's kind of my thought process around it, is that, I it's not my job. It's not my job to convince other people how amazing this is, right? What my job is to show up and create the best, most incredible experience and help people get better, right? And help patients get back to life and help patients lift their kids and help as many of those people do that as possible.
so
And so,
it's like the show don't tell. Like I really taken that upon myself, like just show don't tell.
yeah,
And I'm really curious to see, you're in 2 rural states now, right?
yeah,
And then like I'm curious to see if you expand into a non-rural state,
yeah,
and see
yeah.
what happens.
Something like Alabama or something like that.
Yeah, pretty Arkansas.
Well, prior to COVID, telehealth utilization was more prevalent in urban areas than in rural areas.
Yeah,
Um,
convenience.
Convenience, I think that's it, and
And also
and also
utilization in
accessibility.
general. Yeah,
Yeah, accessibility also. A lot of rural areas, like you said before, bandwidth,
right.
and not being able to uh, get connected. Um,
Yeah,
but going forward, I mean, I like that you're starting in those rural areas. I
yeah.
mean, that those are the markets where they need the access, right? And the
Well, yeah, and
healthcare is.
Was there a reason for those states? Just curious.
yeah, because nobody else, like if you look at tech and you look at healthcare startups, everybody's West or East Coast, right? Nobody's here. Yeah, so part of it was with some partners there, part of it was strategic, but also just like the population that we can serve that nobody else is serving, right? Like, I mean, Uber didn't start in, Nashville, right? Like nobody starts a, no one started a
Only
healthcare,
country music started there.
right? Like, I mean, look where Walmart started, right? Benton, Arkansas. Like there's things and opportunities and spaces that people don't really recognize. And it's an opportunity to really work with people that need access to care, right? Like I mean, I grew up in Louisiana, so I can speak about the South. And the South is not, as we know, and data supports, not the healthiest place, right? If you look at any type of kind
Mhm.
of any kind of demographic data on the South, it's typically that belt along the South that has the highest rates of obesity, diabetes, heart failure, all of the things that kill us early, right? And so arguably, that's going to be the needed area to target healthcare change and kind of philosophy around health that needs to be changed the most in this country. That has I think like, do you take that pocket and elevate it a little bit, or do you take, a super higher end population and elevate it a little bit, right?
Well,
Like how
it's also the question of is that low lying fruit, or is there a
a
barrier?
reason.
Is
Yeah,
there just a wall that
right.
you're not going to be able to communicate with some people
I
who are
know.
not open to being healthier and they're happy with their lifestyle and their culture and everything about it?
Yeah.
You know, hopefully with the right message coming from the right
Mhm.
people, it will make a big difference.
Yeah, and I think that's what we've seen.
Yeah.
Most people in the South, medical interventions and medical interactions are negative. It's always something wrong. You've done something wrong. Why are you still eating that? Why just stop smoking? Go walk. It's not a positive environment for health,
Sure.
right? And and so I think the fundamental philosophy at Vori is really meeting that person where they are and supporting them for who they are, where they are, not like being directive, but really using that patient and provider therapeutic alliance to create shared visions, shared goals for that patient. So I think for a lot of people going through what we're doing, they're experiencing healthcare differently, which will hopefully evolve to them experiencing themselves and health differently. Does that make sense, Adrian? Like it's when you
Yeah,
when you
100%. I mean,
yeah
I grew up, my oldest sister went to Clayton, Georgia. So rural Georgia. So we used to go down for quite a bit of time. I went to Texas Tech for 4 years nonstop, like 4 times a year. So
yeah
I have a special place in my heart for the South. And I think that's where, my passions lie in entertainment, obviously, but tech and all
yeah
that stuff. So I think that tech and what you guys are doing is is a very big opportunity to change that, and through just the visual system and just technology, but it's also a challenge, as you said. So i
yeah
think i think you said like the poor health outcomes in the South and in the country. I think there's a big opportunity. And I think if you can change that, the next generation can flourish and do better and kind of learn better. And so I think that's, even like, yeah, I grew up and I grew up very influenced by urban and underserved community, and then also the rural underserved community as well, and
yeah
the rural privileged community and the urban privileged community. So I've had an interesting lens of seeing all those things, and just seeing like farmers markets pop up nowadays in these communities. I'm just like,
right
oh, and it's changed. It actually has changed quite a bit, and just
yeah
more providers here that represent the people who live here, or even in the South. I think that's really important. So,
yeah
you know, speaking the same language, I think it's meeting people where they're at. I think that was the most amazing thing you said, was that I think PTs, we want you to come to our clinic because we're the experts and we have the kind of we became doctors, and you want to come to us. And I think the difference in the digital is that you have to meet in the center or you have to meet them at home. That's kind of a different thought
mindset.
process,
Yeah, it's a
mindset.
mindset.
Exactly.
Yeah, I mean, Adrian, you said so many layers there that I think are really, I just it's a beautiful way to communicate, right? Like you're on every. First of all, not only do we need to meet patients where they are, but your providers need to look like you too, right? So we have, we're at Vori, we're very conscious of that, and like the content that's made out there. I mean, we've talked about this in the past, right? If you look at any exercise library out there, it's just a bunch of, no offense, but just white, middle-aged, typically sports broad women that are demonstrating these exercises, or somebody who's super fit, right? Like, and so a lot of people disengage from home exercise programs because it doesn't look like them. It doesn't feel comfortable for them to exercise watching someone who's got a six pack, and built like a tank doing external rotation. Like that doesn't there's a non-compute. And so like meeting people where they are on every level, I think, is how we need to really truly disrupt and change healthcare. And I love your point about the intergenerational healing that can happen around health. because honestly, what we're doing now, I hope that the impact is, 1,000-fold in the next 3 to 4 or 5 generations, that we can have an impact that can last much longer than what we see as humans here today. So I think that intergenerational education and knowledge and safety and acceptance around health is a massive, massive part.
Yeah.
We're getting close to the end, but quick question, Mark. As far as the bandwidth and cell towers and reception and the whole access to the waves, right?
Yeah.
What are you guys doing to mitigate that, or what's been the workaround? Or
we're still working on it. Still trying to, you can the video clarity bandwidth can be adjusted, things like that. So there's, we can mess with the quality of the video to decrease the need for bandwidth. But we're working on ways. We're working on web parity, so you can not just have this on your phone, but you can also have it on your desktop at home. So also ways that to decrease the need for cell service and having the tablet be the only option, because there's still lots of desktops in the South and laptops, and so that's another way that we're trying to solution. But decreasing the amount of synchronous time and pushing content to asynchronous, which of course takes less bandwidth as well, helps. So content, exercises, things like that are important. And really, in the patient care's perspective, through messaging and through content and information, that really can solve a lot of issues, right? I mean, it's just an information opportunity for patients. They need, as Jerry Durham always says, it's like if you can help with fear, doubt, and uncertainty, you can help patients navigate space, right? So information is key when it comes to patient care.
We're going to wrap it with a Jerry Durham quote. That's awesome.
Yeah, love it.
He's
Awesome.
gonna love that. He's gonna reshare this and post it. Take credit.
Jerry. Mark, as usual, after every conversation I have with you, I feel smarter. So thank you. Thank you. This is awesome. This is a great conversation, dude. I'm so excited for what you're embarking on. What you've already done is amazing, and what you have in front of you is even more amazing. And I love that you have huge ambitions and bold visions of what this is going to be. So we're all eager to see how it all plays out for you. And I expect huge things.
Yeah. Well, Dan and Adrian, I greatly appreciate you guys taking the time to talk to me tonight. It's awesome to what you guys are doing as well. Like we're all pushing the growing edges. That's what we're doing, right?
Yeah,
like,
right on.
we have to, even though it makes us uncomfortable and makes other people uncomfortable, I think we're all in the path of doing the best thing we can, that we know we can, for patient care and help people get better. So I'm definitely not alone in this space, and I'm thankful for you guys there too.
Awesome.
And all the others. So
thanks, man.
Thank you.
We're gonna have to do this again sometime soon.
Yeah.
And
6-month follow-up, something like that.
Sounds good, man. All right.
Yeah.
All right, fellas.
All right.
Great podcast, and have a great night.
Take care.
See ya.
Night.